All right, so we're going to talk a little bit about rhinoplasty today. This is one of our very commonly performed procedures. People that are candidates for it are anywhere from the age of like 18 years old to older. And basically it's for people that kind of want to reshape their nose. Some might have a little prominence of the dorsal hump. Some might have a wide tip. Some might have a really wide base of the nose. Can be a lot of different things. I would tell you the very first thing and the most critical thing when you're doing rhinoplasty is the analysis. You have really got to be able to evaluate someone's nose, be able to see proportions are, and once you can do a good analysis, then you can basically make a plan of the things that you want to do. I often talk to patients about the 3 top things that they want to see fixed, and then I do their exam. I measure the length of the nose, I measure the projection, I look at the inside portion of the nose where the septum is, and all of these things are very important because the structure of the nose also affects the function of the nose. And so when you're looking at the nose, it's basically the framework is comprised of the bone on top, and then you've got cartilage at the bottom. So you've got both what we call upper and lower lateral cartilages. And all of this is just directly underneath the skin. So when you look from the side, if someone has a real prominence of the dorsum and a big hump in this area, some of it might be bone and part of it might be cartilage. And so those are the things that you address in that situation. With the septum in particular, this picture is as if I were to take half of the face off and you're looking directly at the midline portion of the septum. So you've got bone in the back portion, and then you've got what we call the cartilaginous portion here. So in the curved part of the septum, if I remove part of that, that's going to facilitate not only potentially breathing, but it's also going to help with those that have a deviated septum and therefore kind of a crooked nose. I can also later use that septum as a graft to help with structural support. Anytime I'm taking out septum, however, I've got to make sure that I leave a 1 centimeter L strut intact. Otherwise, you can get loss of projection and the nose gets flat. Okay, so this is a good example, illustration of somebody that comes in with kind of a prominent dorsum or dorsal hump, as we say. This is part of the bone, this is part of the cartilage, both of which are going to be affected, and then you can see what it looks like once it's been repaired. This is a good example of someone that comes in, has either what we call a boxy tip or a bulbous tip, but basically they don't like the width at the tip here. So by shaping the cartilage, as you can kind of see here, I'm able to basically bring this together. So when you're looking at the nose from the bottom up, kind of worm's eye view, you can see how much more improvement we can get in the tip itself by shaping that cartilage. These are a couple of examples of patients. Somebody that came in, had some prominence of the dorsum, wanted to take that down, particularly didn't like photographs from the side. So not only took down part of the bone, but part of the cartilage itself, and then stabilized it on the inside with what we call a septal extension graft from part of that which was removed. And so now you can see, much better overall proportions of the face, real soft. Instead of being wide in the tip here, once this has all been put back together, you can kind of see how this is just almost more like an equilateral triangle and a lot softer look. This is somebody that, again, similarly came in with sort of this dorsal hump here, ill-defined tip that was almost rotated down. When she would animate and smile, the tip would come down and have kind of a plunging tip. And so I think you can see like how even the shape of the nostril is improved here. And again, to give her kind of the look that she wants. And even from this side, you can see how much improvement there is within the nostril, whereas this one kind of turned down prior. Now this one is a lot more elegant. You can see almost half the inside of the nose as well as the outside portion in the ala here. So again, it's just about putting it in balance. So the biggest thing when you come in for rhinoplasty is for me to basically do an analysis, kind of look at the nose, look at all the proportions, do the exam. You convey to me kind of what your 3 things that are your top things that you really want to address. And then from there we make a plan and then can do the procedure. Typically takes me about 2 hours to do a rhinoplasty. When I'm finished, there's a splint on the inside on either side, and then there's a little external splint. Those all come out at about 1 week. So the recovery, from the first 7 to 10 days, you're going to probably have some bruising and some swelling. after about 2 to 3 weeks, really with exercise and stuff like that, you can kind of do most everything that you want. I tell people to wait about 6 weeks before playing, you know, like volleyball, basketball, and things like that. But it's really not that big a recovery. A lot of people come in now, particularly because we're taking so many photographs and social media is such a big part of our life, and they don't like, in particular, how their nose looks, or they don't like the way that their chin is. And these are kind of things that we can address, and sort of after the analysis, go over the things that we think we can fix. So give us a call if this sounds like it's something that you would be interested in.